Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. Welcome back. It is exactly 8:33 a.m. and we are going to now talk with Dr. Akhtar Hussain. He is with the South African Medical Association, and let's talk about, hopefully, the end of the fifth wave of COVID-19 in South Africa. Dr. Akhtar Hussain, Assalamu alaikum. Welcome to the program.
Walaikum salam and assalamu alaikum, the Salam Media's listener. How are you?
Alhamdulillah, with your duas. Nice talking with you this morning. Would I be correct in saying that it is the end of the fifth wave of COVID-19, but that does not necessarily mean that it is the end of COVID per se, because like flu, I guess COVID is endemic. Going forward, we're going to possibly see newer strains emanating, and we're then going to have to deal with those strains. And inshallah, we do hope they won't be as serious as the initial strains that that we were dealing with at the start of this pandemic.
Jazakallah for your very important question and query. Definitely, fifth wave is going down, is very mild, and is a part of the extension of the Omicron. Omicron is the very virulent, spreading fast, but we didn't have many death, many mortality, and it was a very mild infection. What happening? This virulent will keep coming. The virus do change character. If you remember SARS virus, chicken virus, so many different. It's a time to go away. So some country do have a sixth and fifth and sixth wave, and we are very lucky this month. The cases of fifth wave is very low, is dropped down, not many death at all. Even there's a death, those are the comorbidity death. So what we did in South Africa, initially lockdown, very strict lockdown for 21 days. Then we went to stage 2, stage 3, stage 5. And we really worked very hard to practice non-pharmaceutical method like mask, hand sanitizing, social distance, because there are no treatment for virus. What we have, it was a panic reaction to manage all those hypoxic patient, pneumonia, patients are end up in a ventilator. So we tried every method. So now, fourth and fifth wave, we have now learned from the evidence and observation study that masks do prevent infection myself if I'm wearing. But this is a observational study or a report. It's not proven that masks is preventing all the infection. Yes, there are some benefit, especially preventing the tuberculosis, flu virus, seasonal infection. So those are the benefit, especially senior citizen or senior uh, people who are having diabetes, hypertension, other comorbidity, because they go for every year flu shot or flu vaccine that protect the lung infection. But now, if we say we don't want to wear mask, it's good because we have practiced 2 years. We are used to it. But certain places, I think we, for the health purpose, like overcrowding area, to prevent tuberculosis and cross infection, closed door area. But now science and the evidence is proven that it do help, but not sure. We need a bigger study. So the minister is dropping on the basis of that cases are dropped now. Infectability rate is now less than 1%, and the hospital admission is very few. In fact, the ICUs are empty. Hospital beds are available. also the no one dying at the moment with the COVID-19 and especially Omicron. So those are the good signs. So let's see next 48 hours what the minister and president decide. They got a task team to make sure that lockdown go away. Of course, this lockdown need to be stopped because our economy is deteriorated because of this strict lockdown and the social gathering, all these things need to be revitalized because COVID-19 also caused a lot of mental and psychological distress to the community, to the family. So it's a good news, but we need to use our science and we must not make decision on the emotion.
So, Dr. Hussein, let's look at the situation then. Um, the call will be made for us to not necessarily, we don't need to then, masking won't be compulsory, so to speak, in public spaces, shopping malls, etc., and indoors where there are lots of people. You have indicated that it does give you a certain degree of protection. There will be those people who will still opt to wear masks in public spaces, in shopping malls, etc., and that is their right. That will be a good call on their part. Maybe they feel they are vulnerable, they do have comorbidities, and they'd rather practice caution. That being said, where do we stand on the position of vaccines? Because there have been talk around minors and the under 12s being vaccinated. Is that still a good call to be made? And where do we, South Africa, stand regarding the vast majority of the population being vaccinated? Are we at the point of herd immunity?
Definitely, let me go back again on the mask. Even we've been wearing masks, 70 to 80% people did get infected, symptomatic or asymptomatic. Or some people didn't even know that I got a COVID because some antibody from the individual is very good and he didn't even feel. Only time I have so many friends, they went to hospital, some checkup, they did the COVID test positive, but he had no symptom. So that's how in South Africa, almost 70 to 80% people were infected, whether they're sick, very sick, or not sick. So now coming back to vaccination, we have not done well on vaccination from the beginning. The world started vaccination long before our vaccination. In fact, there were crises when the AstraZeneca vaccine came. It was about to expire, and we have to send it back where it came. So we've been waiting for Johnson and Johnson, and then the policy that Johnson and Johnson must be given only to the health worker. Then what happened? Other community. Then the senior citizen, those who have a comorbidity. The majority death was our above 60, 65. So we didn't do very well on the starting to roll out vaccination. By now, we should have vaccinated almost 40 million people from South Africa. And the world have a 500 million infection, and they have vaccinated 40% of the population. Now, uh, Europe and the US, the day they started vaccination and they started dropping masks, but we with the anti-vaccine and different myth, should we go for vaccine, should must not get the vaccine, and the delay rollout, and so many myth against vaccine, and people are frightened and they have so many stories of complication. Vaccine is the only way to protect from COVID-19. If we had now more than 80% of 40 million or 45 million population vaccinated, we had herd immunity already. And we do have a herd immunity, but we should have free from COVID-19 long before. But it is a delay rollout. Still, the vaccination centers are empty. I will suggest people, those who haven't got the vaccination, must get the vaccine. Question left with the children. We started up to 19, then we came to 12, where the US and other country vaccination is about 3 months, 3 month or, and I don't know why our community is frightened to get vaccine, because the day baby is born, our children, our babies, day 1, 0, they get BCG vaccine. 6 weeks time, they get 4 or 5 vaccine, measles, mumps, rubella, hepatitis. In fact, by the 1 year time, they already got 40 doses of vaccine. So nothing happened. I don't remember anybody dying with the vaccine. Do patient do die, but there must be some causes. They are not even COVID-19 people are dying. We just saying no, no, this patient died with the COVID-19. But if you really look at it, history, they may have a severe diabetic, she may have a renal failure, and even nowadays, what I see in the hospital, those who coming for chronic disease and do the test and become covered, the cause of death is covered. It's nobody's dying covered. It's a what is pre-existing disease which is causing more problem. So definitely we need to vaccinate and get out of the mask, and that will be freedom for us.
I'm still going to wear my mask when I go to the shopping malls and in crowded places. At least it'll protect me against flu viruses and any other viruses that might be doing the rounds. But that being said, Dr. Hussein, let's look at the issue around. I know that in the UK, I've just heard that their COVID cases has risen by 40%. We are in the middle of winter. Inshallah, we don't see a rise in cases. We're thinking of, obviously, we truly believe we're seeing the end of the fifth wave. But in terms of another directive that was published by the South African Medical Association, you must be aware of it, suggesting that people over the age of 50 should go for a booster shot. Is that then going to protect them further? Are you all for it? I'm sure you are, because you are with SAMA. Uh, there doesn't seem to have been too much of a push regarding this booster shot. What more can you tell us about it? And why does there seem to be almost disinterest as far as the public is concerned to go for this booster shot?
Definitely, booster is going to help. And with the booster, those who have already COVID-19 positive, symptomatic or asymptomatic, and they're going for their immunization or vaccination, and they have got the Pfizer 2 dose, after 8 months or 7 months, they went back to booster dose. Of course, this will, in a certain time, the immunity of the body decrease. So you need to boost it up. This is the idea. If you remember, we give a booster dose for a cancer patient or a chronic lung disease patient. Every year we give a flu vaccine to boost his immunity up and protect. Because once you get that infection, your chances of deterioration and complicated your system is higher. So that's how the booster will protect ongoing. It's a every year issue. And as it is now, the COVID-19 virus, coronavirus, during his peak time, all this flu virus and other para-influenza virus was decreased. We haven't seen those things many. And as you said, you will wear the mask. Yes, you will be protected from tuberculosis and the flu virus.
Inshallah,
But the issue,
inshallah.
issue is we are using cotton mask. Cotton mask is only going to protect you 10% or designer mask. This is nothing to do and and the people are matching masks. Okay, it's at least, but there's a 10% protection. But health worker need to use N95 mask or surgical mask you wear, which has got 3 layer inside, and it's properly masks must be used properly. It must cover whole. nose, face, chin. So no leaking and no touching. But people are just hanging in the ear, neck side of the neck. So definitely booster doses is going to be helpful. Now we need more campaign about the booster doses, and especially we have learned that our mortality and death rate in South Africa more than 100,000. So people were initially was panicking and running and looking for a vaccine to get this. Now they're not hearing the death, and the fear is going down because they before every family they used to have a sad news, breaking news that there is a death, there is a ICU, the ventilator. Let me give you another good example. Those who are vaccinated last 1 year, none of them end up in ICU on a ventilator. If I tell you the statistic, weekly statistic of South Africa, we have 666 hospital, public and private, and we check who are the people getting admission with the COVID-19 in a hospital. So what we found, most of them, most of them are unvaccinated. Most of the death was unvaccinated people. And those who vaccinated, even single dose, they had mild, they have been admission, but they've been discharged within 48 hours. So you can see the benefit of vaccination and how to get rid from COVID-19.
Inshallah, and that's where we will leave it. A very strong message from you, Dr. Akhtar Hussain, about go out and get vaccinated, get your booster shots if you haven't yet.
Definitely.
And soon it will be no masks at all. So, shukran very much for your time. Lovely
One
talking to
more,
you.
one more thing to add. There was a lot of noise about ivermectin. Now, people, please don't use ivermectin. It is banned from SAPRA, that scientific committee. So we must not use ivermectin tablet. They are not authorized because it's causing liver damage. It's not scientifically proved at all to use in human being. This is the drug for the animal, dog and cat. So, and
Absolutely, yes.
also the anti-vaccine is not doing any benefit to spreading rumor and myth to the our community, and it's nothing to do with the halal or haram. And other thing, as you said, winter, it's also proven whether it's a winter or summer, virus don't see all this weather. If you look at if you look at
Okay.
if you look at the Asian country, the summertime temperature was 45 degree. Afghanistan temperature was 52, but there were a lot of COVID and lot of death in Asian country. Europe, it was a minus degree. Canada was -7, -5. They had a lot of death in America. Almost 5 million people died in USA.
Okay, unfortunately, that's all we have time for, but it was wonderful talking with you, Dr. Akhtar Hussain from
Thank you.
South African Medical Association, and keep us in your dua. Assalamu alaikum to you.
Wa alaikum salam. Jazakallah having me with you. Thank you.
It is exactly 8:52. In a minute or two, we are going to be listening to a voice note, a Mubarak voice note from the Holy Land. So do stay with us.